Respected viewers of Equinoxe Television, it's time for the news. Thank you so much for joining us. We begin right away with our major stories. The local population of Mbanga in the Mongo division are complaining of serious insecurity in that area. They complain more of separatist attacks coming from neighboring Kumba in the southwest region of the country. And also in this newscast, Cameroonians continue to complain about the high cost of living in the entire country. They say it is now very difficult for them to be able to feed their families. Plus, in this newscast, it is exactly 4 years since Prime Minister Chief Dr. Joseph John Gute was appointed by President Paul Biya, and civil society actors in Cameroon think the post of the Prime Minister in Cameroon is just a window dressing. Stay with us for details and more. Welcome back, viewers. Thank you so much for according us your time this evening for the news in the English language. We just told you a while ago in the headlines that it is exactly 4 years since the Prime Minister of Cameroon, Chief Dr. Joseph John Gute, was appointed by President Paul Biya, and some civil society actors in the country think the position of the Prime Minister in Cameroon is just a window dressing. Our reporter Innocent Aze spoke with some civil society actors here in Douala. He now tells us more in this report. We come back to this report by Innocent Aze. He tells us that it is exactly 4 years since Chief Dr. Joseph John Gute was appointed Prime Minister of the Republic of Cameroon, and some civil society actors he spoke with think the position of the Prime Minister in Cameroon is nothing less than just a window dressing. Let's now have his report.
On the 4th of January 2019, that Chief Dr. Joseph John Gute was appointed Prime Minister of the Republic of Cameroon by President Paul Biya to succeed Philemon Yang, who had held the post since 2009. Chief Dr. Joseph John Gute's appointment came at a time the nation faced socio-political tensions, especially the escalation of the Anglophone crisis. 4 years as PM, many think he has done nothing in that position.
I think that Prime Minister John Gute hasn't really played a major role in these problems in the Northwest and Southwest because of the system, which is corrupt and doesn't give him the power to exercise.
Despite this, Chief Dr. Joseph John Gute is seen as a humble and dynamic leader.
I see a Prime Minister who is very dynamic, understanding. I see a Prime Minister who has listening ears. He's a Prime Minister who loves peace. He's a Prime Minister who is an intellectual who understands the needs of the people.
Looking at the executive power of Cameroon, which is topped by the president, the second in command is supposed to be the Prime Minister, the head of government. The 68-year-old diplomat has been of good faith, good character and positive actions.
Even if his efforts to address state-burning issues proved barren, it will be injustice to give him a thumb down.
When he was appointed, he has been very, very instrumental to see that the Anglophone crisis come to an end. The Prime Minister of government, since his appointment, has done a lot of make the people talk. He started in Bamenda, he came to Buya. He spoke with the same group of people. He went to Kumba even, talked to the people of Kumba. The non-state actors, they should disarm themselves and go to the DDR. That the problem cannot be solved through guns. It can only be solved through dialogue.
We have seen instances where he preaches love, reconciliation, tolerance, peace. That is the power, or that is the character trait of a good leader. That is the character trait of a prime minister, not someone who is out to do communication to make people get angry or to provoke people.
PM Joseph John Gute, according to Dr. Bosiniba, merits the position entrusted him by the head of state.
The Prime Minister has not been sleeping since his appointment. I feel that the Prime Minister has been a square peg in a square hole. He has been ensuring that economic boom goes back to the Northwest and Southwest, political stability, decentralization could be effective.
Despite all these, many Cameroonians, especially disgruntled Anglophones, believe the PM has not been given full powers to exercise his duties in order to put the falling nation on a solid foundation.
And now let's listen to other political actors who think despite the good faith of Prime Minister Chief Joseph John Gute, his hands are somehow tied in the execution of his duties, and the position of the Prime Minister is just a piece of cake to appease Anglophone Cameroonians. Let's now listen to Dimato Michael in this excerpt.
Communication was given to Prime Minister John Gute since the beginning of this Anglophone crisis, we wouldn't have had something that is not under control.
In one of the president's interventions, the president talked about having given the Anglophones the post of the Prime Minister. It is like a piece of cake. You know, it is like something that he has dashed the Anglophones with. It is not as if it is a post that is supposed to be active in a country, in a republic, in Cameroon as a whole, but it is as if it is a remuneration that the Prime Minister has given to the Anglophones. So the Prime Minister himself has no initiative, he has no decision, and he has no power to implement anything. So why should we blame him? If he doesn't call the President of the Republic, nobody respects him, no minister respects him, no Director General respects him, and therefore it is the President of the Republic who is the Alpha and the Omega in all that happens in Cameroon. So that is the situation we are. Are we in actually in a mire where escape now at this present moment is very, very chimerical? We don't have to blame the poor man. He's only doing the little he can do, and he cannot go beyond his power. Even the power that he has been slashed by some people. Evaluating him for the few years that he has been in power, I will say at one moment, I would say that he has been much more like a scarecrow. You know, the Prime Minister has been a scarecrow, I must say this, because we have not seen him acting as the head of government. There are a lot of things that have been happening in Cameroon. We have had ministers who are embezzling. We are having a minister, you heard of the COVID gate, you heard of the can gate, you heard of all this. I think that if ministers are implicated, when he sits for his monthly meeting, we are supposed to hear a report that the Prime Minister has hit his hand on the table and said, this has to stop. But can he stop? He cannot talk tall. He cannot talk tall, because if he talks tall, another minister will talk taller than him. This is what is happening. We have had issues about the Secretary General of the Presidency, who is the one signing things that the Prime Minister is implementing. On the contrary, the Prime Minister is really supposed to be the one who is supposed to order. So he has, as I said, they're giving the good and they're holding the rope. So you just have to do with the limit.
And Cameroonians, especially those who live in the economic capital Douala, continue to complain about the high cost of living. They say it is more and more difficult for them to feed their families. Talking about Douala, Douala has been ranked as the 70th among the most expensive cities in the world and 12 expensive cities in Africa. This is according to a US-based institute, as you tell us, for me and Trong Sanda.
On the cost of living in Douala, these Douala city dwellers say living in Douala has become exaggeratively expensive. They say prices of basic goods and services are on a steady increase, making life unbearable.
Monsieur, ce n'est pas ça. Ça a augmenté de 50.
Ouais, je pense que pour quelqu'un qui vit ici.
Like them, a similar observation is made by a United States-based Mercer Institute, a statistical institute specialized in monitoring cost of living worldwide. In its annual cost of living index, Mercer ranks the cities of Douala and Yaoundé among the most expensive cities in the world. In fact, Mercer places Douala on spot number 70 on the list of most expensive cities, while Yaoundé comes on spot number 100. On the African continent, Douala occupies the 12th position, while Yaoundé comes on the 14th spot.
Des biens et services suivants.
Explaining why Cameroon's major cities made it on the list, an economic analyst, Elise Yonta, says Mercer's index centered on the cost and access to the following services: housing costs, cost of transportation and nutrition costs, which are extremely high in Douala and Yaoundé. In general, Yonta says the cost of basic social amenities in Douala is high. A 2020 report from the National Institute of Statistics reveals that every individual needs at least 8,000 francs CFA to live decently in the city of Douala. Some Douala city dwellers on their part say life in Douala is expensive because of the city's overcrowded nature. To analyst Elise Yonta, there is an urgent need to engage in large-scale construction of social houses all over Cameroon, beginning with the cities of Douala and Yaoundé. Another option, according to him, will be to decongest Douala and Yaoundé by creating enterprises and opportunities in other parts of Cameroon.
And now in education, we take you to the southwest region in Kumba. The government technical high school in Kumba is said to be in need of more adequate equipment for their laboratory. The worry was expressed by the school principal during the visit of the delegates for secondary education for the Meme division as the school resumed for the second term of the academic year 2022-2023. Let's now have the details with our staffman Martin Dikan Gabriel.
It was a calm and quiet government technical high school that we met as the second term of the 2022-2023 academic year resumed. At GTHS Kumba, it was just a handful of students we met in their classes. GTHS Kumba has many challenges.
The school, being a second cycle school, has a very low student enrollment coupled with the insecurity situation which really hampered the school situation in Southwest and Northwest. Very difficult sometimes for us to attend 300, 350, 400 students per school year. Our structure is even underutilized.
The authorities of Government Technical High School Kumba are pleading on the government of Cameroon to renew their machines in the workshop. The machines they have are those that have been there since the school was created.
This is a technical school. And the technical school, when we talk of a technical school, we talk of the functioning of the workshops. And the workshops are there from the creation of this school, from the time that this school started in 1991. They have never done any renovation or any maintenance as far as equipment is concerned. And that is really our cry.
During the visit, to see how effectively the second term began, the delegate of secondary education was at the Cameroon College of Arts and Science, CAS Kumba. Unfortunately, till now, students of CAS Kumba are still coming to school with assorted dresses, which indicates that the security situation is still not very stable. But the Meme Secondary Education boss was happy with what he saw.
The evaluation has been so impressive. The turnout on the first day we visited schools and the enrollment was above 80%. As at now, as I'm talking like this, the enrollment is getting close to 90%. From the look of things, by the end of the week, it will be 100%. I'm very grateful for the administration, for the peace that reigns.
He is promising tough times to teachers who have abandoned their work, putting the crisis as an excuse.
Some of them, their files are on my table. I made a tour and appeal to them, especially those who are living out of Kumba and then they think that they can stay away. That if a teacher did not teach them, they would have been where they are. Their files are on my table and I told them that not long from now, I think the consequences will befall them because I will send them to hierarchy for the hierarchy to make appraisal of these files because some of them are very, very bad, very, very bad.
Kumba, should be recalled, was also plagued by the Anglophone crisis, which caused schools to be abandoned by many pupils and students.
And in Nangai Boko in the Central region, the pupils and also administration of the government technical high school in Nangai Boko are complaining also of inadequate infrastructure that was on the first day of back to school for the second term. Besides insufficient equipment in the laboratories, they as well complain of the absence of potable water on the school campus. Mala Glory completes the story.
Studying under unfavorable conditions, broken classrooms with roofs blown off from the buildings, thus exposing the children to the sun and the heavy rains. We are at the Government Technical High School Nanga Eboko, the Upper Senaga division of the Central region. Apart from the poor infrastructure, the students also complain of lack of equipment for their practical sessions.
Ici au lycée technique de Nanga et Boko, nous vivons plusieurs difficultés. Le premier problème.
Here at the Government Technical High School Nanga Iboko, we have so many difficulties. We don't have good infrastructures, very limited classrooms and no roofs. We study sometimes in the rain and the sun. We are limited workshop and lack of equipment to carry out our practical session.
Non pas d'atelier. Les matériaux nous n'avons pas pour pratiquer.
These challenges were echoed on the first day of school for the second term of the academic year. In addition to this, some students complain of not having their report cards for the non-payment of the PTA fees. Commenting on the issue, the school principal blamed it on some irregularities. I and my father paid my fees at the start of the school year, but was surprised that my name was not on the list. These children who are complaining is simply because some paid but their names are not on the official list. Others are with receipt but are not students of this school. Before I got here, I was told some projects were done, but while on the field, the story was different. That is why till today, even part-time teachers are not paid. The PTA coffers have been empty to do some works.
Déjà payé avant notre arrivée et cet argent a été utilisé.
Second term being the shortest and the most important, the student pleads with the competent authorities to reconstruct the school and equip their labs to enable them study effectively.
And now over to Mbanga in the Mongo division of the Littoral region. We told you in the headlines that the local population there, they are complaining of serious insecurity caused by hit-and-run separatist fighters coming from neighboring Kumba in the Meme division of the Southwest region. They lead that complaint to the divisional officer from the Mongo division during a walking visit. Let's now have more with our reporter Lucy Liengu is here.
Insecurity has been a major challenge to the population of Ndo Beach in Mbanga Littoral region. The people have been complaining of attacks by alleged separatist fighters from nearby Meme division of the Southwest region. To fight against insecurity in Mbanga, the divisional officer Nkiefo Christian during his visit has urged the population to collaborate with security officials.
Happy New Year. They will never tell you how again for work. I don't feel any talk where chief never talk. No say for the village chief day. No.
Aside of insecurity, which is fast gaining grounds in Ndo Beach, the population also complain of poor roads, which according to them has encouraged separatist activities.
This have been waiting there for years. They suffer for road.
Business people here find it difficult to circulate freely on the road because of separatist attacks, and sometimes they don't get alerts earlier, which is dangerous. The situation is very critical, so my wish is for the roads to be arranged.
To Ndo Beach, not a fight.
The chief of Ndo Beach equally asked the population to report any suspected case and avoid being accomplices.
And now we talk sports viewers. Cameroon's intermediate Lions are preparing for the African Nations Championship CHAN. The boys of coach Alioum Saidou left the country late Tuesday evening. The list of the 23 players selected for the competition was without current top scorer of the Elite One Championship, Emmanuel Mahop of Canon of Yaoundé, and the youngest player of the year 2021, Wasu Patient of Pasiang of Cotton Sport of Garoua, a sports writer. As Giovanni Wane tries to give reasons for the omission of the names of Emmanuel Mahop and Wasu Pasiang from the list. Let's now have the reasons behind the absence of some players on the list in this excerpt.
the fact that, more people are clamoring for the highest goal scorer at this stage after the first round of the Elite One Championship, Emmanuel Mahop, who people think would have been in that list of canon of Yaoundé. But I would like to emphasize here that this is a work in progress and something that has, they've not had so much time, Alim Seido and his assistant David Pius, to work on this list. In fact, one of the times which they had to work it was during the match against Jamaica, Cameroon's last home game, the farewell game against Jamaica. And most of those players, if not mistaken, most of those players who played in that game, that was the period where they had to prepare, because look at it was snappy. After the World Cup, immediately, like 2 weeks or so, they had to call these players back to camp. So it was some sort of it was difficult to take players who just after the work started performing really well after the World Cup. And when you look at most of the goals scored by Emmanuel Mahop, it came in after the World Cup, though he scored some before the World Cup. And equally talking like a player like Wasu Pasian, I would say he's a youngster who's growing, and it is really not a good thing to do, to play a youngster like that in over 4 categories. Pasian Wasu has been overworked and he needs some time to cool down and relax. And I think he's going to play for other categories, but it's not good to belabor this youngster.
And viewers, that was it for the first part of the news. Thank you so much for being there, but don't go away. Talking Points comes up next. We will be talking health. Tonight we are talking about cervical cancer. Just like the month of October is dedicated to raising awareness on the prevention and also cure of breast cancer, the month of January is consecrated to raising awareness and also prevention and why not cure of cervical cancer. And statistics from the World Health Organization indicates that in every 2 minutes at least 1 woman dies of cervical cancer across the world. And our guest tonight is Dr. Florence Manjo. Doctor, thank you so much for accepting to talk to us on cervical cancer tonight. My very first question, what should the common man, Cameroonians, know about cervical cancer?
Thank you so much for having me here, and I want to say that cervical cancer is really a threat to the life of many women out there. And cervical cancer, when we talk about cervical cancer, it is cancer that begins at the level of the cervix. The cervix is that area that opens up when a woman is in labor and the child passes through, and the cervix is the neck of the uterus or the neck of the womb. Cervical cancer simply is the growth of abnormal cells, like I said, that start on the cervix, and it has the tendency to grow and go to other parts of the other organs, neighboring organs, that has the tendency to spread. So that's when we call cancer. When we have abnormal cells that grow and they have a tendency to spread, that's when we call cancer. Cervical cancer, like I've mentioned, is a threat to the life of many women. Every 2 minutes, 1 woman dies because of cancer of the cervix in the world. When we come to our country, Cameroon, you realize that 8 women are being diagnosed with cervical cancer in a day, and out of these 8 women, 5 of them die. It is really a threat to the life of many women. So, in brief, that is what I can talk about cervical cancer.
And now, can you tell us your experiences with your patients? Because we have been made to understand that most people come to the hospital late. Can you tell us your experiences with your patients in the oncology ward?
One thing I have realized in the field is that many people who present come at a very late stage. They come when it is already too late. This is simply because many women wait for signs and symptoms before they come for screening. People don't just get up and come for screening. They wait to have signs and symptoms before they come. With cancer of the cervix, it takes a very long time. It takes about 10 to 20 years from the time you are infected with the human papilloma virus that causes this cancer. It takes about 10 to 20 years before you can present with cancer. And what happens is that many people or when you are infected with the human papilloma virus, you have no sign, you have no symptoms. So nothing shows on you that there is a problem. But there is the abnormal growth of cells that is then multiplying at the level of your cervix. So by the time that many people are coming at the hospital, they come when it is too late, when we have little or nothing to say. Many people come at the stage that they even say this is more of a death sentence, because when they come just after a very short time, they are dying. From what you heard from the statistics, out of the 5 women that are diagnosed in Cameroon every day, out of the 8 women, 5 of them die. It is simply because many of them come at a very late stage. So what we encourage is people need to come when they are not having signs and symptoms. When they come for screening, when they are not having signs and symptoms, then if there is anything, maybe be it at the pre-cancer when it is still starting, we will diagnose it and treat it so that we can reduce this number of people dying from this preventable cause.
And yes, cervical cancer seems to be preventable and also treatable. And why does it usually affect more people from sub-Saharan Africa, from the statistics from the World Health Organization?
Yes, when you look at the statistics, you realize that 85% of people presenting with cancer are people in developing countries, and sub-Saharan Africa is one of those areas that is highly affected with this with cervical cancer. One thing that I must say is that cervical cancer, like I said, is caused by the human papilloma virus, and the risk factors for people to easily get it are people who have a poor immune system. When you don't have a good immune system to fight diseases, you are at risk. People who have multiple sex partners, people who have one partner with multiple sex partners, people who have had more than 5 deliveries, these people are at risk of having cancer of the cervix. And when you get to sub-Saharan Africa, you realize that there are many people living in the sub-Saharan Africa with HIV, and people who are living with HIV, they have 6 times higher chances of getting cervical cancer than somebody who is HIV negative. So when you see these high numbers coming from the sub-Saharan Africa, HIV is one of the reasons for this high number. And when you look at it, like I said, cervical cancer is preventable. It is caused by the human papilloma virus. We have vaccines, and in Cameroon, these vaccines are free for young girls. And now the good thing is that the minister has just signed that we can vaccinate our young boys too. So we have vaccines for young boys and young girls for free in Cameroon to prevent them from cancer, from the human papilloma virus, which can cause cancer of the cervix. And the other thing is that we can do screening. If you come for screening, we diagnose you at the pre-cancerous stage. That's the good thing there. What we do is that we treat. In our health facilities, like where I work, we are able to treat all pre-cancers. We have ablative treatments, we have excision treatment. It is easy, we can treat, and it cures, such that by the time it is getting to cancer, we have already handled it. So like I said, it is possible that we prevent cancer, and it is possible that we eliminate it.
And now, Doctor, talking about vaccines, it is advised that girls of 9 should get vaccinated so as to prevent cancer of the cervix. And we want to know, people are usually hesitant when it comes to vaccines. What other vital information should Cameroonians know so as to prevent cervical cancer?
We want to prevent these young boys and girls from contacting the human papilloma virus. That is the main goal. And when you look at these boys and girls at the age of 9, between 9 and 14, many of them are not sexually active. And one thing with the human papilloma virus is that it is sexually transmitted. So most of these girls are not sexually active. So we assume that they have not been infected with the human papilloma virus. And with such, we see that they when they get older, even if they get in contact with the human papilloma virus after they have been vaccinated, it will not have any effect on them. And with that, we are going to prevent cervical cancers and other cancers that are caused by the human papilloma virus.
Why are adults not vaccinated?
Adults are not vaccinated simply because many of them, like I said, are sexually transmitted, and we want to prevent. Human papilloma virus is one of the highest sexually transmitted infection in the world. At the age of 50, about 80% of women or people have already had the human papilloma virus at one time in their lifetime. So what happens is that we want to concentrate on these people that we are sure that have not come in contact with the human papilloma virus, so that we prevent them. Because if you have the human papilloma virus and you are taking the vaccine, it will not help you. So what we want to do is get the young children who have not yet come in contact with the vaccine, give them the vaccine so that it prevents them. By the time that they get in contact with the vaccine, the virus will have no effect on them. But we rather call on the adults 25 years and above to go for a screening test. When you go for a screening test, then it will help you. When it helps you, because if they can diagnose a pre-cancer, it will be treated. And if they diagnose your cancer early, then you will equally be treated and it will cure. But when you stay and come at a late stage, that is when there is a problem.
And now, Doctor, any last words for those who seem to be ignorant about how extremely transmissible the human papilloma virus can be to humans?
What I want the population or any person listening to me at this moment to know is that prevention is better than cure. When we prevent, it is better. Because when you come for your screening test, if it is diagnosed early, you will be treated. And when you are treated, you are cured from the disease. If you bring your young boy, your young girl, they are vaccinated and they are prevented from the cervical cancer. And with this, you will see that you will not spend much, because when you already have the cancer, you're going to spend much money just to calm the situation. We do not want people to spend much resources, much money to calm the situation. But our desire is for people to be healthy. So I call on every woman listening to me, go for your screening test. And when you go for your screening test, make sure you respect what the doctors or the nurses will tell you. As you go as a woman, we encourage you to take your daughters, to take your young boys along, so that they can be prevented from this human papilloma virus that is causing a lot of cancers in our community. Just to mention that the human papilloma virus is also causing cancer of the cervix, cancer of the anus, cancer of the vulva, cancer of the vagina, and cancer of the penis. So the men and the women, we all need to be prevented. So take your young boys for vaccination, take your young girls for vaccination. The female ladies 25 years and above, go for your screening test.
And now, thank you, Doctor, for accepting to talk to us on Talking Points tonight on health. And viewers, we thank you so much for always being with us on Equinoxe Television. Don't go away, our programs continue as usual. The news in the French language comes up at 8 p.m. Stay with us.